Pneumonia and pneumonitis are two respiratory conditions that affect the lungs but are caused by different factors and present with varying symptoms. Pneumonia is typically an infection caused by bacteria, viruses, or fungi, leading to symptoms such as a persistent cough, fever, chills, and difficulty breathing. Pneumonitis, on the other hand, signifies inflammation of the lung tissue, often caused by irritants or allergic reactions, which may result in a cough, shortness of breath, and chest discomfort without the infectious component. Treatment for pneumonia usually involves antibiotics or antivirals to tackle the infection, while pneumonitis requires reducing inflammation, often with steroids, and avoiding the offending irritants. Risk factors for pneumonia include a weakened immune system, chronic lung diseases, and smoking, whereas pneumonitis can be triggered by exposure to certain chemicals, drugs, or radiation therapy. For a thorough understanding, let's delve into the detailed aspects of each condition and distinguish their individual characteristics. Affected system: lower respiratory tract versus upper respiratory tract. Pneumonia and pneumonitis both affect the respiratory system, but they differ in their specific locations and underlying causes. Pneumonia primarily targets the lower respiratory tract, inflaming the alveoli in the lungs. It's often caused by infection with bacteria, viruses, or fungi. The symptoms are typically characterized by coughing, fever, chills, and difficulty breathing. Conversely, pneumonitis refers to inflammation of the lung tissue, often stemming from inhaled irritants, allergens, or reactions to drugs rather than pathogens. It can affect both the upper and lower respiratory tracts, but is usually focused on specific areas of the lungs. Symptoms can be similar to pneumonia, but might also include a dry cough and shortness of breath without the infectious symptoms. Correct diagnosis is crucial as treatment strategies differ significantly. Pneumonia often requires antimicrobial therapy, while pneumonitis may require corticosteroids and avoidance of the offending agents. Nature of illness: potentially life-threatening versus generally self-limiting. Pneumonia and pneumonitis both involve inflammation of lung tissue, but their underlying causes and potential consequences greatly differ. Pneumonia is generally caused by an infection with bacteria, viruses, or fungi, leading to consolidation and infected lung tissue, which can be life-threatening if not promptly treated. Its symptoms include a productive cough, fever, and breathing difficulties, and it often requires antibiotics or antiviral medications. Pneumonitis, on the other hand, is inflammation caused by irritants such as allergens, chemicals, or drugs. It is generally non-infectious. It tends to be self-limiting, resolving when the irritant is removed, and secondary infections are avoided. Symptoms like a dry cough and shortness of breath may be less dramatic than in pneumonia. Prompt and accurate differentiation between these conditions is crucial for treatment. While pneumonia needs aggressive management due to its potential severity, pneumonitis focuses on identifying and removing the irritant and managing the inflammation, usually with corticosteroids. Failure to identify the correct ailment can lead to inadequate treatment and potential complications. Typical duration: weeks to months versus days to weeks. Pneumonia typically manifests with a cough, fever, and difficulty breathing stemming from bacterial, viral, or fungal infections. It often necessitates antibiotics or antiviral medications and can last for weeks to months, contingent upon the patient's immune response and treatment effectiveness. On the contrary, pneumonitis, an inflammation of the lung tissue, often resulting from irritants or allergic reactions, not infection, presents with similar respiratory symptoms. However, its duration is comparatively briefer, ranging from days to weeks, depending largely on the removal of the causative agent and the use of anti-inflammatory treatments. Misdiagnosis or delayed treatment of either condition can lead to chronic complications, emphasizing the importance of recognizing these nuances to ensure appropriate care. Common symptoms: high fever and difficulty breathing versus cough and mild discomfort. Pneumonia and pneumonitis, both conditions affecting the lungs, present challenges in diagnosis due to their overlapping symptoms. Pneumonia characteristically triggers a high fever as the body mounts a strong immune response to the infection, often bacterial or viral. This response is coupled with difficulty breathing due to fluid or pus in the lungs' alveoli, reducing oxygen exchange capacity. Pneumonitis, on the other hand, is usually a result of inhaled irritants or allergens causing inflammation of the lung tissue. It often presents with a cough and mild discomfort rather than the intense symptoms of pneumonia. Accurate diagnosis is critical, as treatments vary significantly. Pneumonia might require antibiotics or antivirals, while pneumonitis is managed with reducing inflammation and avoiding irritants. Usual treatment: antibiotics and hospitalization versus rest and over the counter medication. Pneumonia and pneumonitis, while affecting the same organs, involve starkly different treatment regimens due to their differing etiologies. In pneumonia, a bacterial, viral, or fungal infection inflames the alveoli in the lungs, which typically necessitates a course of antibiotics if the cause is bacterial and may require hospitalization for severe cases, particularly in vulnerable populations such as the elderly or immunocompromised. On the other hand, pneumonitis is an inflammatory reaction often caused by irritants or allergens, and its treatment is focused on reducing inflammation, usually with corticosteroids, and avoiding the offending irritant, rather than combating an infection. Care generally revolves around rest and potentially over-the-counter medications to alleviate symptoms, and hospitalization is less common unless the condition has led to severe complications. Understanding the nature of the lung condition is crucial for an effective treatment plan.